And this is a WHO figure.
Right.
17.9 million people die annually of heart disease. And I think the sedentary lifestyle, because of the advancements in technology, physical activity has gone down, and this fast food eating habits have gotten worse. Obesity is on the rise, air pollution is there. So all these things contribute. There is awareness for all the other diseases which cause heart disease, like diabetes, hypertension, and smoking, but still overall all the other factors that are contributing are still keeping cardiovascular disease as the
But I
number
think
one
this is
killer.
like the most important, most glaring one, which is why we have you here on the show. But having said that, is it always necessary that these factors like if somebody has a certain kind of a lifestyle, if they have a sedentary lifestyle, it is necessary that they will end up having heart diseases, or is there a correlation? Because I see so many people who would overtly look very healthy, but they end up developing heart disease at the end of the day.
So yes, I mean all the factors play in together, and we can explain about 80% of it because of the risk factors, but 20% we can't explain. Some people see 30-year-olds coming
exactly,
in with heart attack,
even 20-year-olds,
and not very obese, but family history and genetics has a strong role to play as well. So
Exactly.
obesity, sedentary lifestyle are one of the risk factors, but the other things, if you're diabetic, hypertensive, the environment you're living in, what's your physical activity, all those things contribute
Exactly,
as
they
well. But sedentary
overall
lifestyle
make an
itself,
impact.
it's
Exactly,
not, yes,
but genetics of course have
yeah,
a role to play. Your point is noted, but coming to you, basically you've been in Pakistan for the past 12 years. So how do you see the fitness industry evolving in this last decade in Pakistan? Where has the paradigm shift been?
No, actually it's doing very, very well. Because the past 12 years, when I came to Pakistan, the gym thing was not like, it was not an in thing. People were not so much into actually working out.
Yeah.
And then at the rate at which restaurants are opening right now, gyms are actually even opening up. Like at every block, right, like if you go to Gulbag, every 2 blocks you'll find a restaurant. Now you'll find a gym also, a fitness center close by, which has been very, very good. And most importantly is the fact that women are actually taking over as well.
Exactly.
Now there have been also all these boot camps which have been happening. So basically Pakistan is actually taking
And I think
a
it's
different...
not just about the boot camps, there are so many other factors that are contributing, like the sportswear industry that has really expanded. So I think that is also making its due contribution to the fitness industry. And then I think the social media has a very important contribution to make, with all the celebrities and the social media influencers, telling everybody to stay fit. So what is your client base like?
A lot of women actually, because initially I used to train a lot of men, but for the past like 5 years, I've seen a lot of women getting into fitness to an extent of actually even becoming fitness trainers as well.
Oh, that's interesting.
Yeah, and it's amazing because even they're doing such a good job in the industry as well. Like if you look around, a lot of women are social influencers, some of them and they're doing a very good job in actually encouraging and educating the public in terms of what they're supposed to wear, in terms of gym wear, what they're supposed to eat.
Although very frankly speaking, I would beg to differ, because I think it's something that is being used, both negatively and positively. But I think to look at the positive side, yes, it's good to see more women in this industry. But sir, taking you on board, we've generally been talking about the changing fitness trends in Pakistan, and Jack has briefed us on that. But since you've been the minister, I would want you to delve on this changing concept of fitness in the rural and remote areas, because we are generally touching upon the urban areas.
Bismillahirrahmanirrahim. Thank you for having me on your show.
You're welcome, sir.
And I think you have very good panelists here, in Dr. Nasir and Jack. I think Jack is a well-known name right now in Pakistan. But coming to your question, I think it's extremely important to get the well-being and the exercising of the community into the healthcare system, especially in the fitness center. So in the rural, I think, areas, it is catching on, and that is primarily thanks to you, the media, which has been doing a tremendous job getting the people involved in, throughout the world and here on physical training. But I feel that basically it's, as a health minister, we are here in fact, the health minister is there to frame policies, both in the physical well-being of the people and the patients, and also on the physical and the mental and the overall. It's all interlinked to one another, and also on the hospitals and the tertiary hospitals and the facilities.
So that is something that we'll touch upon during the later part of the show. But coming to you, I think the very important points which the former Minister Saab has raised. But what are the current trends like, Doc Saab? Who is more prone to getting heart disease, and related to heart disease, many other diseases? Is it women who are more vulnerable? Is it men who are more vulnerable?
So I think in terms of gender, there's been a myth that women probably don't get heart disease or heart attack, but it's not like that. They also get significant heart disease. They lag behind by 10 years. They're protected by the estrogen, but after menopause, the incidence becomes equal for both men and women. So the risk factors are the same as in the rest of the world. The diabetes, hypertension, cholesterol, sedentary lifestyle, exposure.
But is it true, Doctor?
But another thing for heart disease is that we, just because of lack of proper antibiotic treatment, as somebody has a sore throat, they get rheumatic disease. That is still really prevalent. I practice in US, hardly saw a case of that. In years you would see 1 or 2 cases, but over here you every day see cases of that, which is a sad story.
So is that like a proper recognized symptom of heart disease?
So rheumatic heart disease, your valves get damaged with that, and they also present they at a much younger age because of the valves damaged, of shortness of breath and palpitations and all kinds of symptoms. So they need eventually surgery for those valves and stuff. So something which is very easily preventable, as Minister Saab was pointing out, apart from cardiovascular disease prevention. This was another thing I wanted to, from the platform of a program, that whoever is listening, if they can use a campaign to prevent rheumatic heart disease in childhood.
That would really help.
Yeah.
Exactly. But coming back to heart disease, because that is the reason why we have you here. So tell us, what is the maximum clientele that you get? Because I've also been seeing that a lot of young people, something that we were earlier discussing as well, they are also falling victim to heart disease. So are the factors, are they the same? Do they change?
So, demographics that I see over here in Pakistan versus practicing in US, I see much younger people, and it manifests at a much younger age, sometimes in late 30s, early 40s, compared to in US, you didn't see it until after 50s for most people. So, the demographics are different. And, a thing that commonly I see, everybody has a low HDL, which is a good cholesterol over here, and our waist to hip ratio is quite off, and the eating habits, are quite bad. So those things all contribute together, and smoking, air pollution, all those things are major factors in these.
And I think this, addiction to technology and to media.
Yeah, that has been a major thing. Young kids, we used to always spend time outdoors playing. Now they're all on
I think times have really changed.
PlayStation
and the COVID has put us back
maybe
where we started off. But would you want to add something to that? Like, how do you relate to what Dr. Noman is saying?
Yes, so my brother here is very right, because if you look at Lahore as a very rich food culture as well. Like if you look at the kinds of foods that people eat in Lahore, they are pretty wanting as well, because amount of oil which has been put in the food, what kind of oil.
They have all the oily foods, and then they rush to gyms to people like yourself.
Exactly, and what our beloved former minister actually said, even walking, like we have, even just walking just helps. But you see, even the culture here is kind of like from the car to the mall, from the mall to the car. So
but
it's
very even in this culture, I know so many people who've managed to maintain their fitness. So in the end, I think it's something that's in your head.
No, but you see, let me just correct you on that. You see, there is a totally different perception of what people think about fitness.
I was about to come to that, exactly. That was my next question, that, when people come to you, when they want to get that, fitness motivation from you, how is it that you motivate them? Because fitness, for me at least, it's a lifestyle choice, it's just not a fashion statement.
Exactly, for you. But you see, most, especially women, most of the women, they want to look good at any cost. So they'll go to crash diets. They'll go to ways in which they can actually just look skinny. So they actually have this perception about being skinny is actually you look good, you look fit.
Size 0.
Exactly. But then that's where now.
But I'm sure you're not encouraging that, because a lot of your clients, they are very well.
The doctors.
They are very healthy and in proportion.
Valid point.
Beauty lies in the eyes of the beholder, not for any benefit of beauty reasons that they should be losing weight, but for health reasons, exercise has tremendous benefits and everything.
So what are, other than losing weight and looking good, do you have clients who just want to exercise because they want to feel fit?
Rarely. Because most of the time, and apparently, most of my clientele who comes through, it's always that the doctor told me to come, mother told me to come, or shadi hai, 1 month I have to get married. I'm going to Dubai for holiday. Can I lose?
Or I just want to lose off my vacation weight.
Exactly. Or I'm going. My nikah is in 1 week. So people have very crazy.
I think it goes back to the same thing, that you need to have your goals defined before you want to get fit.
Exactly. So most of in most cases, you'll always find there's a reason behind it, which is not entirely about being fit. It's always about either I'm getting married, or vacation is close by, or my mother told me you need to lose down a little bit of weight.
I got you there. Sir,
Exactly.
but I would want you to comment on this as well. You know, exercise or no exercise, at the end of the day, what is important is, you know, how easily can anybody in Pakistan access the healthcare system. So, you know, as the former Minister of Health itself, how conducive, how accessible, how available do you find the healthcare system to be in Pakistan?
I think the healthcare system is pretty good in Pakistan. If you look at it, and also on the generally, if you look at even in the remote regions, there are facilities available to all to the whole of population. But also, even I in my constituency, for example, in a very small village, you still have exercise rooms for a small gym, and people are doing the exercise. But on the health sector, we have a complete system, like we have the basic health unit and the rural health centers and the tehsil hospitals, and then you come to the district hospitals and the tertiary hospitals in the cities, like the big hospitals here in Lahore and Karachi and all the big cities. So it is a comprehensive system. The only thing sometimes we have to do is that we have to have a policy straight. And I'm a strong believer in a strong government-run health system. The private systems, the private healthcare has to be complementing the government systems.
How do you analyze the current government's handling of the healthcare system? Because I do feel that they did a pretty good job.
I think they've done a good job, and especially on the COVID-19, I think their strategies have been, they have been pretty good. And overall, I think there are only two systems in the world in the healthcare system. There is one which is funded by the government, which is run by like the NHS system in the United Kingdom, and then Canada, Europe, India, Pakistan, Africa, Far East. And there's only one other system which is in the United States, which is being run by the insurance premiums. So in times of crisis, it becomes apparent that the government-run institutions are always doing better.
Dr. Nouman, I would want to have your perspective on this, because you've also had the benefit of working in US and you currently go there as well off and on. So how do you compare both the health systems?
Well, as Mr. Shah was pointing out, that the US health system is mostly private health system, and its insurance or the third party payment system over there. Only government system which is sponsored for the military personnel, which is the VA system, which is government sponsored. So over there, versus UK, which is NHS, and over here, the quality of care in the private system, I think, is better, is more efficient, is more people are more responsive there. And I think just having a model where they have introduced the Sehat and Saaf card, that's a good concept, that if you're not getting your care in a timely fashion, a government setup or a facility or is not available, you can get access in the private care system as well. People have access to better health care if they're not getting proper access to care
especially
in
the
government
trans
system.
Community of Pakistan,
but the government healthcare needs to be improved as well. In times like pandemics, yes, you have more control over giving good care through a nationalized health system, as has been seen. But in the government healthcare system, there is a big discrepancy. You see consultants are not showing up or not doing their job accordingly.
This is what I was going to ask you, that I think a great amount of the responsibility falls on professionals like yourself as well.
So, they will have, I don't want to say they'll have a justice being paid, a package of 1 million or whatnot, but a professor in, whatever field, he'll be paid a fraction of that.
I think
so you need to have salaries,
competitive salaries.
At least, let's say 50% of what could make in a private setup. So you have people committed to the institutions they're working in, and they take ownership of the patients. Right now, a lot of times you see the postgraduates, the trainees, unfortunately, they are running the show, and the supervision is not as much as should be there.
Okay.
I mean, they try to enforce it, but it's just action on the surface. You could do much more there, in terms of enforcement of quality healthcare.
Exactly. And
there are no quality metrics. So in US, the hospitals are judged based on the quality indicators. You discharge a patient with heart failure, if he got back admitted within a month, that hospital will be dinged for that. The reimbursements from the government, like government does pay the private hospitals through a Medicare system for people above the age of 65. So over here also, if a hospital is performing well, showing good quality indicators, they should get more funding for the money, their consultants or people who are working more over there should get more reimbursement.
I think there is still room for improvement, Dr. Nouman, but at the end of the day, I think other than policy, other than, governance, a lot of things come at the end of the day to doctors like yourself as well. Like I've been to doctors who've not been very accessible. So, I think it's both ends of the argument.
I think government's initiative in terms of making the hospitals more independent is important. Working in the government, if I wanted to get vacation, I heard that my vacation thing will go to a section officer in a health department who has no clue who I am, where I'm working. So that just system being run by,
Sir, but I think that is a general criticism that we have for government-run institutions overall, be it related to medicine, be it related to any other field. Jack, I would want to come to you. We've been talking about the different reasons because of which people come to you for exercise and all. But have you ever had people who've come to you because, they are wanting to get rid of some mental disease? Because, I think this discussion is incomplete if you don't talk about mental illnesses and mental ailments.
Yeah. So, but it's always on a personal level, because for someone to come and actually open up to you and come up and tell you that they're having a difficult situation, maybe with alcoholism or maybe drug abuse, or we have those kinds of clients who come through, and actually exercising helps a lot. Just for them having that space where no one judges them and they feel good about themselves and they can actually start a task and complete a task. So no judgment at all. And you look at them as any other individual. So
are the exercises that you prescribe to such patients different from the ones that you prescribe to those who just want to, look good,
it's basically the environment. You see, once you change that person from that environment whereby they're being looked at differently, to come to the gym whereby they find this trainer who's ready to engage with them, who's ready. Basically, you don't treat them any different as a normal client. Because one, they're running away from a place whereby they're being different in a special manner. Then they're coming and then they're finding someone who's treating them the same way.
But I think exercise coming to you in itself should, give them that comfort in itself.
It does.
Because it's that me time, it's that self-care time, which I unfortunately, which I feel the Pakistani society doesn't,
No, the worst thing you can never do to someone. I'll give you an example. Like, I have this policy whenever you come to the gym, I always tell even my older clients, you leave your age outside, you come to the gym. Because I'm going to train you even as a 25-year-old. Basically, it's how the mind works. Because the moment I start treating you as a 70-year-old, then you start feeling like a 70-year-old.
Exactly.
The moment I start...
Age is just a number at the end of the day. You're as old as you feel you are.
Exactly. The moment I start like stigmatizing you and giving you something special in the gym, then you start feeling a little bit special. Not in the right way, in the wrong way. But the moment I start giving you something which another fit person is doing, then your ego comes up and you feel good about yourself. So that's what it does to the mind.
Coming back to you, sir, we've been generally talking about the healthcare system, and Dr. Nouman briefed us about, the comparison. He made a very, I think, comprehensive and very apt comparison about how the healthcare system is here to what it is in the US. But we are also talking about mental health, and I think personally that mental health is one issue which is very much ignored in Pakistan. So how equipped do you feel is our current healthcare system in terms of accommodating this as a serious issue?
I think it's one of the most important sections of the health sector, and I was just giving the example of the earthquake in 2006. One of the problems that we had was, after the earthquake was the mental health of the patients, because they went through a tragic time and a horrific time, and that is exactly the same situation right now in COVID-19. So today it is so relevant because people have lost their loved ones and who are being on the recovery side, people who are not feeling well and so unwell. Mental health becomes a huge problem when they lose their jobs, they are unemployed, the other economic and physical problems. We are equipped with it. I think we in Pakistan have a lot of psychiatrists and other psychologists to take care of this, but this has to be enhanced now to a new level.
Okay. But having said that, we've seen that the government is very focused, especially in COVID-19 times, on dealing with this pandemic, which as it is predicted to be the next pandemic now. So how do you see that?
They're doing a good job and they're pretty focused, and they must be looking at this side of the mental side as well. But because it's in such an emergency, there are so many things going on right now with COVID that other sometimes strategies are taken a bit on the back seat. But I think the government is looking at it.
Would you want to add something to that, Dr. Noman?
As you very rightly pointed out, that mental health becomes even a bigger issue during the times of pandemic and crisis, as that happened during the earthquake, and then now during the COVID pandemic, that we are seeing, especially you're isolated at home, not going out. All those things play a role, and so these helplines are very crucial
they are
and important.
doing a great job,
and you know, to help people out during this time. And as a cardiologist, you know, mental health has a role there as well.
I was about to come to that exactly. That what is the link, sir, between cardiovascular diseases and mental health?
So you know, people who are suffering from depression, bipolar disorders, or whatever, schizophrenia, whatever mental illness you have, they are not as compliant with the medications, and that indirectly impacts on their healthcare as well. But also, you know, stress and some of these mental illnesses have been correlated with endothelial dysfunction, with the lining of the vessels can get affected indirectly with that as well. And you saw this in times of crisis when they looked at incidence of heart disease that went up. You know, so there have been some studies supporting that as well. So indirectly, you know, can't really gauge stress.
Of course, yeah, but there's a
correlation there
but
as well.
Is this possible, Dr. Saab, that people who come to you complain of heart diseases, they develop anxiety or depression later on because of the heart disease?
Yes, yes. So especially people after a heart attack, it's a major, especially who have, you know, go into heart failure problems with that, it's a major sudden life-turning event for them. And you have to be on watchful for that as well if the end is developing in signs, symptoms or depression or anxiety. And also post bypass, we see patients who need support in that regard as well. So I think you have to look at as a person as a whole, and
mental health and its relation with
as well.
Just not with cardiovascular disease, with so many other diseases. But coming to you, what do you do to keep yourself sane? Because, you know, I was reading this very interesting article, Jack, you know, which said that a lot of people who are actually who used to go to the gym, one of the trainers I knew personally, they've gone into like a depression mode because the fitness industry itself has, you know, had such a big crunch. It has completely, if not vanished, it has basically, the dynamics have been really changed. So how do you maintain that mental health balance for yourself?
So basically, sometimes you have to keep in touch with what's going on around you. So the whole Zoom thing came in, and people started doing online training, which actually worked out very well because a lot of people started engaging into online classes whereby you actually do things online, and it worked out perfectly. So people never stopped actually to work out. But it was not the same feeling whenever you go out and actually do something and work out and all. So I would actually say that if you could have kept in touch with what was going on around, a lot of Zoom classes were done.
But do you feel that, you know, the way that the fitness industry has now been impacted, it would be saying like goodbye to the studio, goodbye to basically going to gyms, because to a great extent a lot of people have stopped going to gyms?
You see, I'll tell you, that's why I was actually telling you something that you have to look around and see what's going on. Of late, a lot of cycling groups have been started. So a lot of people are doing a lot of outdoor activities, which is a very, very good thing.
Which is very good, but then again, you know, as a female, I feel that maybe it's not as accessible to women,
you see,
basically. So you have to take the whole, everybody's argument. A lot of women have complained that when they go out cycling, they are being harassed. So I am talking, that's a separate actually argument altogether. What I'm talking about is the fact that, you know, how do you feel has the fitness industry been impacted in Pakistan because of COVID? And when I talk about the fitness industry, I'm talking about that experience of going to the gym and, you know, meeting trainers like yourself, doing exercises there, because now I feel at least that there has been a greater shift to online exercises.
Yeah, definitely that has happened, because even till now, a lot of people still, even after getting the COVID, infected by COVID, they still have that fear factor of actually coming back to the gym. So it's really been affected. A lot of gyms, some of them have actually closed down.
Exactly, this is what I was saying.
So it's been really, really, really tough. So especially for the business owners who actually run the facilities.
And also for trainers like yourself, whose bread or butter it was for that matter, because I think since COVID has affected so many other things, it has definitely affected adversely your industry too. But would you want to give some policy recommendations in this regard, that what do you feel is the way forward?
Personally, I think, you see, there's just as much as what, like, for example, the government can do. And honestly, I think they're doing a good job. If you look around, they have amazing parks around. I've gone to like the Model Town Park, amazing parks around. I think the government is trying to do as much as they can do, you know.
the results have been much better. But now the government should make a policy to try to get as many vaccines as possible and try to get people vaccinated on a large scale. And we have a system whereby we can have all the government institutions, all the hospitals, and all private health facilities like Dr. Nasir is leading or whatever. So many, I won't name any, but there's so many. They should make a concerted effort. And from the rural centers, we have the basic health units, the rural centers, the rural health centers, tertiary, the district hospital. Everything has to be combined, and we have to get the maximum people vaccinated so that we try to control COVID-19. COVID-19, has changed the whole world, and I just want to touch on Jack's point that the health gyms throughout the world are closed, and because of the spread of COVID-19.
Exactly, sir. Your point is noted, but would you want to add something to that?
I think the government is making a sincere effort in getting people vaccinated. It started in the government hospitals for the frontline health workers. And the private setup also where I work, they've gotten the list of the healthcare workers who are in the front lines, and they're going to start vaccinating them as well. And eventually the population who are more at risk, and especially the elderly, but they don't have the vaccination available which they can give to elderly.
No, but then there are opinions about the elderly also not wanting to get vaccinated because they're saying it's not safe for people above 65.
The general message should be that they should only follow the advice of our health department.
Right.
And they're being very careful, very cautious in their approach in terms of the precautions that should be taken. And for the time being, there is no reports that I've come across from any authentic source that there is any harm. We don't know about the long-term effects. We don't force any. There
I think
should be.
It's more about the myths and
for
all.
these live attenuated and RNA messenger vaccines. I mean, generally they have been. It's been okay using them. So
have you gotten your vaccination
done?
done?
Be any different from any of the vaccines.
Yeah.
I'm waiting for the vaccine to come to our hospital. So when it comes, I will get vaccinated as well. I think everybody who gets access to it should get vaccinated. Yes.
Okay, so that's your basically take-home message for all the people out there and all.
No.
Will you get yourself vaccinated?
Definitely. If I get the vaccine, definitely. And same thing as doctors said, I will encourage as well, like everyone who gets access to it should actually get vaccinated.
Right.
Yeah.
And I think one thing that we earlier also spoke about, but we didn't get the chance to, deliberate upon it more.
Yeah.
This use of fitness apps, this has become now like the new thing, the new normal and all.
Yeah.
But do you feel that since there has been a shift in these apps now, in usage of these apps, people like yourself, they would be at a disadvantage because, lesser people would be coming to you?
Not really, because you see, nothing beats, I'm an old school believer, like nothing beats a good walk outside, like what former minister actually said, nothing beats the outdoors, nothing beats that, So people actually are trying to get you off an app, nothing beats it, Whatever you get from an app, you cannot get it from one-on-one or actual gym or actually going and running outdoors.
When I was reading up for this show, I came across the fact that people in your country, Kenya, are deemed to be, one of the most fittest in the world. So how do you compare your experience of working there as a trainer with what it is here?
So basically, being as a trainer in Pakistan, the scope is really big because generally in Kenya, the weather is amazing. So that becomes a very big factor as well, as compared to Pakistan. Because Pakistan, you have extreme weather conditions. It's very hard to people to go outside in summers and run. In Kenya, we were having a discussion with Docsab today. He told me he's been in Kenya. He can actually tell you about the weather. From the time someone wakes up in Kenya, you're always on the road. We prefer actually outdoor activities as compared to Pakistan. Like a Pakistani might decide to use the car to go from one place to another. I'll prefer walking from one place to another. So basically the fitness aspect comes through as well.
Yeah, so basically considering that people in your country are generally considered to be fitter than those here in Pakistan, what are the lessons that we can learn from people like yourself?
And they need to get out. Because there's this culture of using the car from point A to point B. They need to get out. There are a lot of beautiful parks here. You need to get out, at least go do 1, 2, 3 rounds. At least a healthy mind is one which actually gets out and works out.
And I personally have never been a very big fan of outdoor exercises, to be honest. I have to go to the gym and I have this routine in which I have to do that or go for my Pilates session or yoga. So I think going out shouldn't just mean going outdoors.
Exactly. There's so much access right now. We have a lot of yoga facilities. We have Pilates facilities. We have gym facilities. You have no excuse whatsoever to actually sit at home and not do anything. There is no excuse
so
whatsoever.
the basically morale of the whole story is they just go out and don't sit at home, exercise in whatever way possible, in whatever means possible. Sir, but coming to you, we've spoken at length about the law, the policy and the governance when it comes to health and the health system. But how do you feel does the society, our culture, our traditions, they influence, impact health?
I think our culture, and the social life that we lead is critical in formulating how the society behaves. Like Jack has said, I think the first thing is to be active, whether you can do exercise at home or in the small garden that we have here or go into the parks. But certainly our female population is not very comfortable going out in a mixed crowd. And it's because of our culture and religion. In the cities, it's different. But I think the rural areas are different. Sometimes, like we have to look at some of the systems, like in Dubai, have parks timing just for women, so that they come, they're comfortable, they do their exercises, and they go out. And the other is also we have to encourage our women, our daughters, and our wives and our sisters to do more exercise. Unfortunately, because of our cultural handicaps, women do not.
And also, sir, my female viewpoint, which I believe is very relevant since I'm the only female on the show, is that access to such opportunities should also increase, and I think the family system should be such that it should be more encouraging, more supportive of the same.
Absolutely, I totally agree with you. I cannot concur more. But I think facilities-wise also, like all facilities that we have, like parks or in cities, they can have timing, special timing just for women for 4 hours or 6 hours, maybe thrice a week, so that you encourage the ladies to come out and be comfortable and do the exercises. I want to thank Jack for doing a good job in Pakistan. Warigani, Jack.
And most of his clients are females. It's something that he has admitted, basically. Yeah, which is great, yeah. But coming towards the conclusion of the show, what would your take-home message be to all the people out there who are watching this show, that what are the prevention tips, what are the lifestyle choices that they need to make in order to not be a victim to cardiovascular diseases?
As the fitness guru Jack pointed out, we need to get off our behind and start moving and exercise in any form and way that you can do. So 4,000 steps a day, if you're physically moving around, your job involves that, you don't need to take that extra time out. But 7,000 steps is even better. But at least 4,000 steps a day, if you're counting your steps, you have all these smart watches, or half an hour of activity, physical activity daily, which can be moderate intensity, brisk walking, or whatever you enjoy doing, swimming, bicycling. But you
exercise in whatever form.
In whatever form, but half an hour of that is very important. But he was talking about getting the elderly to feel like young people.
He has a lot of elderly clients,
but so should be careful in those cases. Sudden heavy activity that you're not used to doing can be harmful. So exercise is very good for you, but sudden heavy activity that you're not used to doing can cause a trigger heart attack.
So basically monitored exercise.
So it's monitored exercise and gradual build up is important.
And in terms of food, what tips would you give to eat healthy?
I think there have been a lot of diet debates out. You hear about keto diet, and then you hear about the Atkins diet, South Beach diet, and all the. So there's no randomized comparison of these diets, but one diet which whatever data we have, which shows observational studies have shown Mediterranean diet from cardiovascular standpoint is the best diet, which is mostly plant-based foods is where your caloric intake should be. A lot of
and
fresh
that is
fruits,
something that anybody
veggies,
can take.
lentils you should take, and anybody can take all that stuff, but avoid cold drinks, fast food, cake, pastries, desserts, just minimize the use of those. And we're seeing a lot of that happening with kids going to fast food with the westernization that's happening. A lot of the fast food.
I think that's something that happens with everybody. Dr. Noman, maybe you are very particular about it, but I have a sweet tooth. Everybody has a sweet tooth at the end of the day.
And I also, but you just have to try to limit the use of that as much as you can, and
take it in moderation.
Take it in moderation. And an American Heart Association has a nice description in detail of the diet, because the time limitations can't go over that, but about all the ingredients and things that you can have over there. But mostly plant-based foods, and about people ask about red meat. You can have once or twice a week, but try not to avoid deep fried things.
Just eat healthy.
Eat healthy. Olive oil, raw form, cold compressed, that has a lot of polyunsaturated fatty acids. So all oils which have the polyunsaturated fatty acids are preferred over oils containing or transsaturated fatty acids should be avoided. Apart from that, weight loss and the government's initiative to just check a simple blood sugar level, cholesterol level, and blood pressure. These three things, these are the three major risk factors that can be addressed and controlled. So if they're abnormal, then the people can start getting treatment for those, because these are silent killers. They can go unchecked for a long time and cause a havoc in your body. So getting them checked in a timely fashion and getting treatment for them is very important. And it's very simple and cheap way.
Exactly, and I think this is something just not related to heart disease, Dr. Numan. It's something which is generic.
They all lead to heart disease.
They all lead to heart disease as well.
Prevention is the key strategy, and it can be done in a very simple way. So, all the centers we have by the government should offer those tests for free. And
I think that's a very valid recommendation. So what would your take-home message be in terms of motivating all the people out there who are watching this show to be fit?
Okay, just to wind up, having been here in Pakistan is such a great country. And the way people actually accept changes and situations is overwhelming. Like the past 12 years, I've actually seen a lot of people coming out, a lot of people actually exercising, and it's made me stay here for a very long time. And as Pakistan being like a loving nation as well, accommodated me as well.
That we are, yeah.
Exactly. So I've actually seen people, they up to change, they really get into, any new thing which comes in, they're ready to actually accept it. If it's exercise, all these new technology in terms of exercising, whatever, people are doing it. So just go out, just do something. Exercise, that's the only thing that I can actually come out and say.
Right. Yeah. Your point is noted, sir. And to conclude the show with you, Minister Saab, what I would want to ask you is, since we are talking about health and healthcare reform generically, if you were the minister today, what reform would you propose, both in terms of policy as well as institutions, so as to make the healthcare system more available, more affordable for the common Pakistani person?
I think the first thing, the government has policies, but I think today there's more need for cooperation and coordination between the provinces and the federal government. So the federal government should support and complement the provinces, and same, well, likewise, the provinces should be supporting the federal government. So the policies are implemented. And the other thing is to consolidate the healthcare systems already that we have, like the rural health centers, the basic health unit, the district hospitals, the tertiary hospitals, and encourage the private sector through their contribution and supplementing and complementing basically the health sector. But lastly, I just want to say that the government is doing, but I think they should really now go forward in these very critical times to cover the population with the vaccines. And the last message I would like to give is, because your show is watched internationally also, but I just want to give two messages. One to Mr. Modi in India. I think he should give the healthcare cover to the Kashmiris, because they're human beings, they're women and children, and they should cover them also with the vaccines for COVID-19. And the other is to Mr. Netanyahu, the Israeli Prime Minister. I think he has stopped giving vaccinations to the Palestinians, and I think it's a criminal act. Because we are all human beings, irrespective of our color and religion.
Of course.
The Palestinians must be given vaccines, and their children and women and all the population vulnerable should be covered. So I think these two presidents, these two leaders of these countries should be wise enough to make the right decisions.
Well, to wrap up today's show, thank you so much, Professor Nomanasi, thank you so much, Jack, and thank you so much, Nasir Khan Saab. Well, to conclude today's show, the only thing that I would want to reiterate in my conclusion is the fact that health is wealth and self-care isn't selfish, because only if you're healthy would you be able not only to look after yourself well, but those who surround you, be it your family, be it your friends, be it your community or society at large. So stay happy, be fit, and learn to love yourself, because everything else then falls into line. On that note, signing off for today. Until next time, take care and Allah Hafiz.